Hi, everybody. Welcome to the podcast. Today we are talking facelifts. I know you've all wanted to hear about this. I mean, I've been dying to have this on the show anyway, and today is finally here. We are talking about not your old grandma's facelift, but the new one that everybody's getting, from Marc Jacobs to Demi Moore to Kris Jenner. The list goes on and on, Lindsay Lohan. And these facelifts are so amazing that you are not just looking refreshed, you're looking like you just haven't aged at all. Today's guest is Dr. Mike Roskies. He is a well renowned surgeon based out of Toronto. He focuses only on the face, and he's going to be here to talk to us about the new age of facelifts, what's in, what's not, the new technique of facelifts, who should get them, who shouldn't. Is 30 years old too young to have a facelift? In my opinion. Yeah. But is 60 years old too early to have a facelift? In my opinion, no, because look at this neck. I'd love to have this neck fixed. Anyhow, we're going to talk the ins, the outs, what to do if you are going to have a facelift, what it involves, what's the recovery like, and also, are we doing too much skin maintenance prior to wanting a facelift? Because that also presents its own problems. So stay tuned, buckle up. I'm so excited. Please welcome Dr. Mike Roskies. Hi. I like your
Hi.
hat. I like your hat.
We're trying to keep it on theme today.
Yes, I'm so excited because I have so many questions to ask, and I know that so many people want to talk about this subject. So having you on is just like amazing to me. I mean, where do we begin? Because well, I already know where we're going to begin. I want to talk about, first of all, I want to get into you, and I want to talk about
Sure.
your credentials and why because getting out of medical school, a lot of doctors are not 100% sure what specialty they want to get into. So for
Hmm.
you, I mean, your background is very impressive. You went to McGill,
Thank you.
um, and then you went on to Cleveland Clinic. So tell everybody about your background, your education.
Sure. So, first of all, thanks for having me. It's exciting to chat with you and to answer whatever questions you have because I do know that there's a lot of misinformation out there, and kind of my entire MO when it comes to being an online new age social media doctor is to help educate instead of, allowing people or surgeons to provide excuses after the fact. So I think the more educated people are, the more they understand the intricacies of facelift surgery and rejuvenation and wellness in general. I think the better equipped they are to go through that journey with their surgeon altogether. So thanks for having me. Um, my journey is a circuitous one. There's no question. I always knew that I would be some kind of plastic surgeon. Even when I was younger, I loved the show Nip Tuck. I remember, creating clubs with my friends who also wanted to be surgeons at one point and acting, as if we were when we were very, very young. And when I got into med school, that dream kind of fell by the wayside a little bit. And I think it really comes down to the mentors that you find and the people whose life and objectives in general resonate well with you. So I actually started off med school by wanting to be a pediatric orthopedic surgeon. And I spent a lot of
Wow.
time in Montreal, we have the Shriners Hospital. And I really loved the environment. It was very friendly. It wasn't like a typical surgical environment in the hospital. And I love the patient population. You can make a huge difference by doing what they do. And I don't know what happened. I think it might have been in my first surgical rotation. Again, I started to gravitate towards head and neck surgery. I remember walking into the OR, and the attending staff at the time was like a 6'3" jovial guy who was singing AC/DC as it was playing in the background while dissecting like this little minuscule facial nerve in the middle of the face. And I was just like, I was marveling at how casually he was going about it, even though I knew he was dead serious on getting the best possible result for his patient. And I looked into general plastic surgery for quite some time. And, to be perfectly honest with you, it came down to the people in my life who I wanted to become and who I wanted to emulate. So for a very long time, I was going to be a head and neck cancer reconstructive surgeon.
Wow.
That was my, my goal from basically year two in med school. That was everything that I devoted my research time, extracurriculars into, and I loved it. I really, really wanted to do that for a career. And so as a result of that, I actually ended up doing my first fellowship in head and neck reconstructive surgery at the Cleveland Clinic. And
That's
I
impressive.
loved,
Cleveland
thank
Clinic,
you.
I have to say.
Thanks.
You know, it's got
Yeah.
it's got a little bit of a reputation behind it.
It was an incredible year because I saw how medicine should be done in every aspect of care. And I learned that medicine is not just about surgical outcomes, it's about patient experience. And it's really about the entirety 360 care, however you want to term it. It's
Hmm.
really thinking of the patient as a person and taking care of all aspects of their life. And that's what Cleveland Clinic does better than anybody else.
Yeah.
And, you know, on the flip side of that, when I was in the middle of it, I realized that while I really loved generating those outcomes and I loved the surgeries, the patient experience fell short for me. I felt
Wow.
like, head and neck cancer is no joke. This is it's a cancer that can be very debilitating for a lot of people. It's in the middle of your
Yeah.
face. And, in the past, it was caused mostly by smoking and alcohol intake. Now we know that there are other things that might contribute to it. And it was just, for me at least, as a resident seeing it from the outside, it was exciting and the surgeries were fun. But when you become almost like a junior staff as a fellow, you go through the journey with your patients and it is very emotionally taxing. And so, for that
I
reason,
bet.
very early on in that fellowship, I realized, okay, I'm not doing this for a career because I'm going to burn myself out and I'm going to hate it. And so I had already had a second fellowship planned in facial plastic and reconstructive surgery. And the intention of that fellowship was just to make my reconstructive skills better. That was like the principal focus for the second year. But as soon as I realized that I was not going to be an academic reconstructive surgeon, we switched gears. I spoke with my fellowship director and I started spending more time even in Cleveland with the facial plastic surgeons. And that was kind of the beginning of my love for all things facial plastic surgery because the outcomes we were generating and the surgeries we were doing were also matching the patient experience that I have come to really love and prioritize in my life, which is, creating really strong bonds with healthy people who, you know, have the surgery, but you see for at least 1 year afterwards. You get to know very, very well. And it's just this, it's this microcosm of what I feel life should be. You each take a chance on one another. And it does take a little bit of bravery to go through those types of surgeries. But when you come out the other end, in the
Yeah.
vast majority of cases, people are so satisfied with the impact you can make on each other's lives. So that's why I don't regret it for a second. And I really love where I am right now. And for the last almost 10 years, this is what I've been
That
doing
you've
every
been
single
doing.
day.
Well, here's a
Yeah.
question for you. So as a technician, I mean, you are a trained surgeon. So when does
Hmm.
I feel like with plastics in particular or cosmetic
Hmm.
surgery that you have to be somewhat of an artist as well because I don't think you can go to the same plastic surgeon and get a facelift or a neck lift or whatever you're doing or a nose job and it's going to come out identical with each surgeon. So, I mean, how much of that do you think is you being an artist?
Hmm. A lot. And I
Yeah.
used to think that that was just a little bit of bogus marketing that some surgeons would
Yeah.
use to differentiate themselves from others. And, over time, what I've also come to realize is techniques matter in surgery, that's for sure. I think your meticulousness in every case does make a difference. But after you've kind of mastered the left side brained part of the surgery, that's the logic, that's following the steps, that's understanding how to kind of take apart a face, then that right brain starts to really influence everything else. And that's the artistic side. That's how
Mhm.
you
Yeah.
put everything back together. That's how for example, you do fat grafting to create more highlights and shadows in the face. That's how you know when pulling is either too tight or not enough. And those are things that you only get perspective on with experience and time. But ultimately, it comes down to patient preference and surgeon style. And I think those things always match when, you and your surgeon are a good fit for one another.
So you said something, let me just see on my notes here, and it was a
Hmm.
really good. It was you say surgery should be about restoration, not reinvention. That
Hmm.
And so what do you mean? That's basically what I guess you're saying. When somebody comes in, like for me, for instance, if I just want to be a little like refreshed, I don't want to change the
Hmm.
way I look. I mean, there might be
Totally.
a patient that comes in to say to you, I want to look like Kim Kardashian. And
Hmm.
they really don't look like Kim Kardashian. Can you like for most patients, I would assume that they just want to refresh. But are there people that come to you that say, I want to look like this person? And
Sometimes they'll
for you,
slip. Yeah, sometimes they will slip through the cracks, but we have a pretty extensive screening process in my office, and much of that is based off of what their expectations are. And I think that, one of the biggest benefits of being on social media and putting my stuff out there is the people that I want to curate as my patient population will end up finding me also. The algorithm is just that strong.
yeah.
So people know that I'm not going to make you look like a different person. And it's because I value the science of what I do, the medicine of what I do. And when you truly understand the aging process and the way that the face starts to descend down with gravity and time, and you kind of look at those little indicators and try to reverse that in the exact way that it has now fallen, then that's a great guide for keeping things very natural. So it really is just reversing the aging process and reversing gravity in ways that we think look very beautiful. Now, you know, nobody will ever look the same that they did 20 years before by just lifting soft tissue because there's so much more involved in aging. It's the quality of the skin, it's the fat pockets of the face, it's bone that has now resorbed. But in general, when you follow those landmarks and you keep that in mind, then you can't really go wrong.
So okay, so let's talk about this whole surge. I mean, this is years ago, you didn't hear about facelifts as much as you do now, right? You just
Hmm.
don't, you didn't. Or you'd go like, and you'd see like the grandma facelift, which was like, oh, I am looking like I just was in a wind tunnel or a hurricane wind,
Right.
That isn't the facelift anymore. And for some reason, because of, I don't know, Kris Jenner or Marc Jacobs, Demi Moore, like Lindsay Lohan, like the facelift is having its moment right now. And
Hmm.
the thing that's so interesting about it is we hear the word rejuvenation, and we heard this is a word I'd never heard before. I'm sure you've heard it, prejuvenation. And so
Hmm.
I'm like, what is prejuvenation? So apparently now it's not only people my age who are 60 who want to get refreshed, but now there's people 30 years old, 35 years old, 40 years old. What do you say about that? Like, is that a real thing? Like, is that something that will prevent you from getting a facelift later in life? Or are you now, because you're going to get into a vicious cycle? What's the truth there?
Yeah, there's so much to take apart there.
Yeah, there really is. I know. Okay,
It's
go
a
for
it's
it.
not just a loaded question. I would say that is the question, right? This is everything that we're trying to answer in consults and,
Yeah.
from the general population is when is the right time to have a facelift and why are facelifts so good? Like how did the facelift get a facelift
Yeah,
basically?
yeah, yeah.
What has changed, right? And if we use Kris Jenner as an example, this is somebody who has done small things over a long period of time, such that even though she looks phenomenal now, that is not just because of one session of lifting a deeper layer of her face. That is because she has prioritized beauty for a very long time. She's probably on a great skincare regimen. She has had other work done. And I think she has a good team around her who understands what is, you know, fluff, pomp and circumstance, and marketing versus what is a true facelift surgeon and what they can actually offer. So I think for me the key is when you're younger, you should be doing small things over a longer period of time, and you should prioritize your skin because the truth is the only thing that you can really prevent on the aging spectrum is not gravity. It will win every single time, even if you hang yourself upside down when you sleep. What you can reverse is the quality of your skin because even when we're doing facelift surgery, we're only removing the quantity. We can't change the quality of your skin. And so for somebody, for example, who has neglected their skin for years and years and comes to me for a facelift, I just know that their result is not going to shine as much as somebody who has done those small things over that period. And so I think for sure, technique has changed over time and surgeons are much better at doing what we do. But I also think that self-care has been part of our popular culture for the very least the last 15 years, where we've been prioritizing cosmetics and skincare and small non-surgical treatments, which in moderation are a very good thing. And that's what gives you a head start. So
So I have
should
a
you be
question
doing,
about that because I
yeah,
don't want to
of
forget
course.
it. You and
Yeah,
I spoke a couple months ago, and you had told me that it can be difficult when someone comes to you for surgery, and you were telling me a story about that you didn't realize that that person had had a Morpheus 8, or they didn't tell you about that prior. You got in there and there was an issue that you solved it, but that it didn't make it as easily for you to meander what was going, to navigate in there. And so is it sometimes that people if they should be aware of some of the things that they're doing prior to seeing you, because those things could impede their final result?
absolutely. When you are investigating a non-surgical treatment, you should be asking three things to your provider. You should be asking, number one, does this work? What's the evidence? Number two, you should be asking, what are we trying to do? What is the indication of this specific treatment? And then number three, this is a bit more nuanced, but you should be asking, what layer of my face is this going to affect? So to go back to that first question, what is the science? What is the efficacy? There is, most people don't know this, but for a device to be approved in North America, it doesn't have to show efficacy. It doesn't have to show benefit. It just has to be safe. They just have to demonstrate that it doesn't harm the
Uh,
population that they're using it on.
right.
So, cosmetic medicine is not the strongest when it comes to evidence and strong peer review studies. Most of it is centered around big launch events, money being thrown at devices, industry supporting providers by, flying them to cities in Europe for conferences.
Mm-hmm.
And a lot of the time that's what's driving why people select individual devices to use. So you have to ask first and foremost what works. Number two, you have to ask what is the indication? Because I have no problem whatsoever with devices like Morpheus 8. Radiofrequency microneedling is a device that basically puts needles in your face and then it injects a little bit of heat or energy. And it's a second generation device that was preceded by something called Fractora, which did the exact same thing, but the needles were much, much smaller and they were much shorter. And that device was incredible because we knew for certain it only penetrated into the first layer of the skin. It just went into the skin.
Right.
And so the indication for its predecessor was it was going to improve the quality of your skin. And then there's this thing in cosmetic medicine, we call it indication creep, which basically means, okay, well, this device works for one thing, one aspect of facial aging. So we're going to see if it works for another aspect of facial aging. And so they made the needles bigger because bigger and better is always the best
And longer.
and longer. And they basically said, okay, well, now we're going to see if it starts to tighten the face. If it goes down to the third layer of the face where all the facial musculature is, that's what we're trying to lift when we're doing facelift.
Right.
And that's the wrong indication because there is nothing short of a scalpel that is going to lift and tighten your face. That's just the honest truth. That's not me selling you anything as a surgeon. I'm more than happy with you not doing a facelift, but the alternative is not a non-surgical device that could lift a little bit. The alternative is not doing a facelift,
Well, see,
just doing
that's
nothing.
really important, doctor, because
Yeah.
I feel like some of these treatments, I've done RF once, and I did Morpheus on my neck. And the reason
Hmm.
I didn't let the guy do it on my face is because I had read, this was a couple years ago, that it could melt your subcutaneous fat. And so I was like, well, I don't want that, because if you don't have fat in your face, or if I lose whatever I've got, then it's going to actually age my face more. Um,
Totally.
and so that's the kind of thing that I think people spend so much money on these procedures and these different treatments that really they're trying to achieve what possibly you could do with, in one surgery. And I think that they could almost spend as much over the years, a couple of years, that they would to go to a plastic surgeon and have it done. Where I don't, the question is I, not the question, but you said it yourself. Like sometimes there's just nothing that's going to replace the actual nip and tuck and lifting it up, right?
That's exactly it. Another example of indication creep, which we used to see a lot of, was, dermal filler, hyaluronic acid was
Right.
invented for, improvement of the skin quality in the nasolabial fold specifically. That's the only indication that exists. And then they said, okay, well, another aspect of aging is that people lose fat pockets in their face. So we started injecting filler deeper into the face and inflating fat pockets. And they said, okay, well, if it can do skin tightening or skin quality and it can inflate our fat pockets, then it's got to be able to lift, because that's the third thing that happens with aging. So people are injecting massive amounts of filler in their temples in the hopes that it somehow stretches out their skin and lifts it. And all they end up doing is sticking golf balls underneath the skin in their temples. It's doing nothing. Okay. But it just goes to show the slippery slope that we go through with cosmetic medicine. When one thing shows some form of efficacy,
Yeah.
there's got to be something else. We got to open it up to a wider population so that we can answer to our shareholders. And I think that's where, the business of medicine becomes a scary thing. Um, and that's where the misinformation comes into play. So, the last question we were talking about was, what layer of the face does it affect? And you answered the question perfectly well. Subcutaneous fat is a good thing. There is no circumstance in which you should be trying to rid your face or your neck of that superficial fat layer that's under your skin, because it's got fat, which produces estrogen. It's got the microcirculation that allows your skin to have vitality. It supports the elasticity and the collagen of your skin. So the second you get rid of that fat, not only might you get a little bit of irregularity or contour problems, but you're getting rid of something that provides us with vitality and youthfulness. So it's not the same thing where a body surgeon might say liposuction has worked for me in the abdomen. Let's go ahead and use it in the face. Those two things are not the same. The aging process does not involve growing fat underneath your skin. So you should
No,
never be
and you
touching
can,
it.
and even like the arms, like you lose like that fat. Because I'm a thin
Hmm.
person, so I unfortunately I can't gain weight very easily. I want to gain weight, but I wish I could just tell it where to go. But anyway, it'll go places I don't
Yeah,
want it to go. But the truth
right.
is, like, I've always thought, like, as you get older, you need to put more weight on. It's almost like save your face. To save your face, you've got to sacrifice your ass, basically. Like, if you have to have a bigger butt. I mean, if you want
Yeah.
to have a better face, because if you lose too much weight, then you just look skinny all over.
Yeah. Listen, I was speaking to a patient today and she said that the best thing you ever, I saw she's a month out from surgery, said the number one best thing you did for me was you did my facelift. And I'm very grateful for that. But the number two best thing that you did for me is you showed me how to prioritize my recovery, specifically my nutrition after surgery, because I was a product of the 80s where calorie restriction and excessive exercise was the way for women to lose weight and look good. That was beauty back then. And
Yeah.
she said to me, in the last month or so since I've done the surgery with you, I've put on 10 pounds. I have never felt better in my life. And this is going to be the new me. So it was like a kickstart for not just her face, but her entire body. And we know that nobody talks about weight loss anymore. That's not how we make people look good. It's, body reconstitution is sometimes the term that people will use. And the idea here is you're reshaping things, you're adding muscle instead of getting rid of fat. And that's how people end up looking good and youthful, and they feel good too.
Although I do have to say, probably your business is going to be even booming further with this Ozempic, Wegovy, people getting this.
Yeah.
I mean, I've noticed it from people I know that have been on those drugs that they do get that, they call it the Ozempic face, and you do see all that fat being lost. And then, they're going to have to come to somebody like you to fix it because, you know, it's just sagging at that point. So I think it is really important that people understand if they're on those kind of things too, that that fat, when it's gone, it's you can't again tell it where to come off. It's going to come off in your face. So
For sure. It's a major downside. You're right. It's a huge part of my practice, and it has been for quite some time where, I would say in the vast majority of patients, they intentionally lose the weight, but unintentionally start to age in a very accelerated way because they have lost that youthful fat in their face. And we go and we do surgery, and we've come to learn that those people are living in like this subclinical state of malnutrition
yeah,
because they are not absorbing as well. And their recovery and healing is not always as great. The vast
yeah.
majority of the time, they heal beautifully well, but there is something much more complex to recovery when it comes to those weight loss medications than I think we understand now. And of course, we'll only realize that in a couple of years once we have good data to support that. But that's my personal experience.
Okay, I want to switch gears and talk about the facelift. I want to talk
Okay,
technical stuff about the facelift,
sure.
because I think we need to decipher why the new facelift or the new facelift of the facelift is so different
Hmm.
than what it used to be. And what is the difference? Because I know a lot of people who have been on social media, you're inundated with, there's a lot of surgeons out there. There's a lot of, really good before and afters. There's a lot of guys that are just really good at marketing
Hmm.
that people are following, and they're charging upwards of $300,000 for a facelift. And some of them are great, but but essentially they have different names for different things. Like,
Yes,
there's the SMAS. Like, I cannot even attempt to tell you what SMAS means, but tell me if this analogy is good. I heard
go
that
for it.
there's a SMAS and then there's the deep plane. The
Hmm.
SMAS is like fitting a sheet tightly over your bed and fitting it so it fits tightly. And then the deep plane is actually also fixing the mattress underneath. That's an analogy that I heard of, making the mattress fit the sheet rather than
Hmm.
just the sheet over a mattress. So what is the difference between a SMAS, and tell us what it is, and your deep plane, which I think you call is the preservation lift, which is
Hmm.
probably your own technique. So tell everybody what the difference is.
Sure. Let's start with a little anatomy primer because I think that if you're interested in facial rejuvenation, non-surgical treatments to the face, and facelift surgery, you need to know this in its most basic terms, no matter who you are. So first and foremost, we have five layers of the face. We have the skin, which is made out of our epidermis and dermis. That's the layer that is great to treat with skincare, with some skin booster hyaluronic acid, with radiofrequency microneedling, like we talked about. Like those are good
Mhm.
things to treat very superficially. The second layer is our subcutaneous fat. This is the layer that you do not want to touch with anything. Sometimes we might inject a bit of Sculptra there, which we'll speak about in a second, is not a problem at all if people understand the anatomy. But in general, we want to preserve that fat layer as much as possible. The third layer of the face is the SMAS. So this is a layer of connective tissue that was discovered in the 1980s. It stands for the superficial musculo-aponeurotic system. Okay.
That's why
So
I
that's
couldn't
what we
say
see.
it.
It's a mouthful. And you know
Yeah.
what? When I was in med school, we do cadaver studies, and I was very interested in facelift surgery even back then. And I asked the very seasoned anatomy dissector to show me what the SMAS was, and he had no clue what that was.
Wow.
And so the fact that you know this now, Mary, in 2025, and he didn't know it back then in the early 2000s or whatever, mid
Yeah.
2000s,
Yeah.
speaks about how far we have come as a society about understanding our faces, which is pretty cool, actually.
Hmm.
The SMAS is layer three. It's connected to the temple muscle, the forehead muscle, and the neck muscle. It's basically one long sheet. Okay, so that's like
Okay.
the most important layer that most facelift surgeons in this day and age are addressing in some way, shape, or form. Okay. In the past, there were surgeons who were addressing layer one and two. Those were skin only facelifts where they'd make the same incisions, they'd cut out a little bit of skin, put it back together and we realized that not only did that not last long at all because the skin has a little bit of stretch and elasticity, but people ended up looking super, super weird because we do
Is that
not
the
grow
windblown
skin.
thing? The windblown
Yeah,
kind of?
still some smaz lifting. Still some smaz lifting can make you look that way. But yeah, sure, you're much more likely to look very windswept if you're just doing a skin only surgery.
Okay.
Um, that just speaks to the misunderstanding of the aging process with a lot of surgeons. And believe it or not, there are still some surgeons who are doing skin only and subcutaneous type of surgeries in 2025. Not a good look.
Wow. Okay.
Okay. Um, Layer four underneath the SMAS and the platysma, which is the neck equivalent, is the D plane. That's where we have those retaining ligaments that are keeping our face attached to the bone. And those are the ligaments that we, in some cases, will release and reposition the SMAS, that layer three, above layer five, which is the deepest layer. That's basically the lining of the bone. So layer one, two,
Hey.
three, four, five, those are the things that I think are really important for people to understand because if you understand those, then you can understand any type of facelift that exists.
Okay.
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 So we talked about layer one, two, old school facelift. You don't touch that. The only reason why you should be touching those layers as part of a facelift surgery now is to gain access to layer three, which is the muscle.
Right.
Okay. So we make our incisions in front of the ear. We peel off a little bit of layer one, two. We get access to the muscle. And this is where many surgeons will differ in their approach. So a SMAS type of surgery is in its most basic form, and everybody's got their own version to it, is basically making a cut in that muscle and doing something to pull it laterally. So you might not even cut it. You might just take stitches and try to fold it on itself. So that's called an imbrication. You might cut through a small wedge of that muscle layer and then again put it back together. So take out a couple of centimeters and put it back together. There are very advanced facelift surgeons who do a high SMAS facelift, which is essentially cutting it along the cheekbone and downwards. And that allows them to lift a very small portion, but more of it, and then tuck that portion upwards. And then there are, a Kris Jenner facelift, for example, is something called a smazectomy, where instead of just very laterally removing the muscle, the surgeon would remove a bit more muscle centrally in the face, getting more pull on the midface structures like the nasolabial fold and the jowl, and then again, just putting that back together.
Okay,
So,
so what is the difference between what she had, because everybody's
mhm,
talking about how great she looks, and
yeah,
when it says, I guess she said it was a SMAS, or he said it was, the surgeon had admitted that it wasn't deep plane. But again, I don't know how
that's
many
right.
facelifts she's had in the past, and maybe
Correct.
this is just a maintenance technique that he did for her. Um, but he didn't. So you said it was different than you said it was a SMAS something else.
A
Ectomy.
smazectomy,
Yeah.
a removal of the spaz muscle, a small portion of it, and then reshaping it. And I think, Kris Jenner is a great example of how technique certainly matters. There's no doubt. Like the science has to drive every decision we make, but at the end of the day, it is the artistry of the surgeon, and it's their ability to carry out that technique in a way that looks very tasteful and beautiful. And that's what her surgeon did extraordinarily well. That's what he does time and time again, right?
Right. Right.
So it is I don't mean to sound disrespectful when I say it's a more basic facelift. He wouldn't even disagree with me saying that. It
Right.
is a more
Right.
basic facelift that, you know, inarguably does not last as long. But in somebody who has had multiple previous facelift surgeries, it is just an easier way of tucking up the sheets on top of the pillows at the end of the
Right.
day
Right.
rather than, if we take that analogy further, rather than having a hotel make your bed in the morning where they essentially lift the entire sheet up from the head to the feet of the bed and then they redrape it as one unit in a really beautiful, clean way. And what I'm referring to is level four surgery. And that's what deep plane facelift surgery is. So instead of just addressing the top of the bed where we're folding the sheets in some way, we're actually lifting the sheets up. We're releasing the retaining ligaments of the face. And then we can use that SMAS muscle, which we now can have full control of, and we can redrape that in a truly vertical fashion. So that allows us not just to put the muscle back to where it was, but that muscle is attached to the superficial fat compartments. And so those hitch a ride on the muscle to redistribute the fat pads in a way that looks more youthful as well. So there's no guesswork there. It's just putting the face back together.
And I would suspect that having a deep plane or a preservation lift, as what you do, I mean, would
Hmm.
not be the same recovery as it would be if you had just the skin pulled or had a mass
Correct. Yeah.
surgery.
Yeah.
What is
All good
recovery?
things.
Because I want you to go into that as well,
Yeah.
because I know a lot of people
Sure.
wonder, like you see on
Yeah.
social media sometimes you can see, oh, this patient is 2 days after having a deep plane neck, face, eye, bleph, upper, lower bleph, blah, blah, blah. And they just look like, wow, they actually look either really bad or they look like, no, they didn't have anything done after 2 days. So I mean,
Totally.
what is the typical um, recovery for what you do as in your deep plane lifts?
Yeah. It's funny because recovery means different things for different people.
Mm,
I'm that type of surgeon, by the way, that never gives a straight answer. And the reason is I've just lived through all of it with my patients, right? So in
yes.
the past, when I used to say, recovery from deep plane facelift surgery is 2 weeks, somebody would inevitably come back at 2 weeks and say, I am not healed. What are you talking about?
Oh, of
So
course,
first,
everybody heals at
so
different levels and
that's right. But
yeah.
it depends on how you define recovery. So I define recovery in two ways. We have the first phase of recovery, which is surgical recovery. This essentially means that you look normal, like a human. All of the major bruising, the unsightly swelling has dissipated. Scars have healed. They're not mature, they're not completely gone, but they are concealable. And you can go about your daily life with a little bit of camouflage. That means makeup, hair down, maybe a hat if you've done your brows. And most people who don't know you, if you're at a grocery store, for example, will not look
Well,
twice
not
at you.
now.
That's right.
Yeah.
So that's 3 to 5 weeks. That's a range for a reason, and it does depend on age, type of surgery that you've had, other non-surgical treatments that you may have had in the past, and of course, your general health. Those things really factor into it a lot. And then the second phase is cosmetic recovery. This is where you feel very comfortable in your skin. Nobody, even people who know you, cannot tell that you've had something done. That's when scars are not just healed and concealable, they're starting to become mature, although it takes a full 12 months for those to go away. But they are really nicely camouflaged in the creases in front and behind of your ears. And most people, unless they're staring right at you, can't tell.
Can't tell.
Yeah, and that's when like people who, just want to go back out in society, if you have a major event, for example, if you're a public facing person and you have an appearance at a gala or you're going in front of the camera, that's the period in which you feel very comfortable going back out and you don't feel self-conscious that somebody is wondering what you did. So that's kind of the cosmetic recovery,
And the
three
other
to
thing
five months.
I wanted to ask you about is general anesthesia, because I know
Hmm.
a lot of people, a lot of doctors now, and I know you're one of them that will also do it under IV sedation rather.
That's right.
I mean, I guess you can choose, maybe. I don't know. Explain that because a lot of people don't understand
Yeah,
why, how could you ever do a facelift under like a twilight IV sedation? Don't they put you under for that?
correct. So, I think it's important to state that every surgeon has their own comfort level. And I think what it comes down to is educating your patients first, preparing them very well, and then risk stratifying them to determine what they might do best with. So there are pros and cons to both of those types of anesthesia. IV sedation is by far my preference. This is just an intravenous drip of medications that we give you, similar to that you would get from a colonoscopy. And it knocks you out to the extent that you don't feel any pain. You don't really notice what's going on around you. You might remember small little bits and pieces of the surgery. However, that is quite rare. Um, but the challenge is that not everybody is a great candidate for it. And, there are some general health conditions like sleep apnea or high blood pressure where you might not fare very well under those medications. If you have anxiety and, you just have nightmares about being in Grey's Anatomy and feeling like you're awake in surgery and people are operating on you, then we might just elect for general anesthetic. But my preference is to go that way because, well, I guess there's two reasons. Number one is the recovery is generally a little bit faster. So the less we knock you out, generally, the faster your brain recovers. And when your brain is doing well, then your body does well. And the second reason is just more of a logistical one. If we're putting you under general anesthetic, there's a tube in your mouth, in your throat to breathe for you. And that can sometimes get in the way when we're trying to operate on your neck. It's not the end of the world. I do it all the time, but it's just a little bit of a pain in the butt.
Yeah.
So general anesthetic's great. General anesthetic is very safe in healthy people. And frankly, when you own a private surgical center in Toronto, where the Ontario government and college is constantly scrutinizing and looking at everything you do, you only do things by the book and you only select very healthy people to undergo surgery in your center because it's just not worth the risk, right? So, um, all of our anesthesiologists are, board certified anesthesiologists, sometimes double board certified in critical care medicine. They're incredible. I trust them with my own family members. And although it is scary to undergo general anesthetic, again, they probably have their own podcast talking about misinformation about
Yes,
general anesthetic,
yes.
just like I do for facelifts. But, the risk of something bad happening to you, especially if there's no strong family history, is incredibly low. And so this is very safe surgery to have. The downside is that you might have a bit of brain fog for a couple of days afterwards. It might be a little bit of a slower recovery, but ultimately the cosmetic result is no different.
So for me personally, like I want to talk about neck because this, for some reason, doesn't really want to act like it belongs to me. So I would
Hmm.
love to get my neck done, but I also know that you have said this as well, is that to, I don't know how old you'd have to be to just do the neck, but all of this moves as a unit, right? So if you just have a really bad neck, and I'm talking to anybody out there that has it, doesn't like their neck, you also probably can't just do the neck, right? You have to do everything move along the whole jaw, the whole everything together.